Hi, I'm Dr. Mad. It's very nice to meet you. Welcome in. Just going to ask you some questions, make sure that I have your file here. I think this is the first time that we meet, correct? Okay. Go ahead and verify your first and last name and your date of birth. Okay. Perfect, thank you. Do you have any allergies? Okay, are you taking any medications on a daily basis? How many milligrams of that? And how many times per day? BAT, okay. Any other medications that you're taking? Metoprolol, okay. Are you taking that in the afternoon? All right. And did you take your last blood pressure reading? How much was it? 118/65. Okay, that's good. Was it in the morning or evening when you took that reading? AM. Okay, great. Any other medications that you're taking? Okay. Do you have any surgeries that I should be aware of? Any complications from that? No. Okay. And how long ago was that? Okay, good. Any accidents that I should be aware of? Any car crashes, bike accidents, roller skating, rollerblading? And did you injure your head? Okay. Did you go to the ER or no? Okay. So you didn't lose consciousness. Any family history of high blood pressure? Okay, yeah, I understand. Any family medical history that I should be aware of? Okay. Are you experiencing any pain right now? On a scale of 0 to 10, how would you rate it? Okay. And how would you describe it? Is it dull? Is it achy? Is it sharp? Okay. And is it intermittent or it stays throughout the day? Okay. Are you experiencing any headaches, any vision changes, blurriness, fogginess? Okay. What about any hearing loss? Right. And are you able to grasp? Okay. So grasping is normal, just a little bit of balancing. Okay. Are you experiencing any back pain, shoulder pain, knee pain? Knee pain. Is that for the right or left or both? Both. Okay. How long ago did that start? 2 years ago. Okay. It's been quite a long time. So I do have quite of information here, and it does seem like you do have a long history and you do go to the doctor pretty often to have checkups to make sure that everything is okay. I'm going to put on gloves and take your vital signs so that I know exactly how you're feeling at the moment. Okay. First, let's take your temperature. This will just go over your forehead. I'm going to have you just relax. Okay, 98.1. I'm going to take your blood pressure. Is it okay if we use the right arm? Alright. So this is just gonna go on your arm, on your upper arm. It's going to give a big hug and a squeeze. Just gonna have you uncross your legs. Great. Okay. Just going to go ahead and slide this down. Good. Your blood pressure is a little bit elevated. I'm going to go ahead and listen to your heart. I just want to make sure that there's nothing concerning, no arrhythmias or murmurs. Okay? Is it okay if I slide the stethoscope under your shirt? Thank you. Okay. Go ahead and first breathe normal. I can hear S1 and S2. No S3, no S4. Can you go ahead and take a deep breath in and hold it in for 1, 2, 3, and exhale. Okay, I'm gonna have you cough one time. Good. Go ahead and relax. I do want to refer you to a cardiologist just to make sure to rule out anything more serious. Let's go ahead and check your lungs, okay? Any coughing recently? Okay. Go ahead and take a deep breath in for me. And exhale. Good. One more time. Breathe in and exhale. Good. And again. Breathe in and breathe out. Very good. Any difficulty breathing? Okay. Go ahead and just breathe normal now. I don't want you to hyperventilate. Okay. Everything sounds good at the respiratory system. I just want to make sure that your heart is doing okay. Alright. I'm going to check your vision first, and then we're going to move to our cranial nerve exam. Okay. Do you wear contacts? Alright. That's great. So I'm just going to have you look straight in my nose. I'm going to flash a light in your eyes. It's going to be a little bit uncomfortable. We're looking for pupil dilation and constriction. We want to make sure that they're equal and responding equally. Good. Okay. Okay. Go ahead and follow my finger with your eyes only. Don't move your head. Okay. Now I'm going to bring the pen light very close to your nose. I'm just going to have you follow it. Okay. I'm just going to do that one more time. Keep on looking here. Okay. Focus. Just focus on the pen light. Okay. Now I'm going to have you look at the light. Okay. Now look at my fingers right here. Okay. Now look at my fingers right here. Now look at the light. Look at my fingers. Look at the light. Okay. Look at my fingers. Look at the light. Look at my fingers. Now look at the light. Still one more time. Look at my fingers. Look at the light. And look at my fingers. Look at the light. Okay. Just gonna have you cover one eye. Just gonna do the same thing. Now go ahead and tell me when you see my fingers in your field of vision. Good. 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 Go ahead and switch eyes. Good. 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 Okay. 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 Wonderful. Go ahead and cover your right eye. And can you please tell me how many fingers I'm holding up? Okay. What about now? Good. And now? Okay. Good. Okay. All right. Okay. Good. Okay. I notice that your right eye is a little bit shaky, which means that it's putting a little bit more strain on it, and we do want to make sure that your eyes are not overworked. I'm going to send you to an ophthalmologist to do a checkup to make sure that everything is good. We want to make sure there are no symptoms of glaucoma or other eye disorders. I'm going to do a hearing test. Have you noticed anything abnormal? Any fluid coming out of your ears? All right. So I'm going to go ahead and make some sounds on the right or left of your ear. I'm going to have you identify with which ear, left or right, you hear that sound, okay? Go ahead and close your eyes. Close your eyes. Good. Go ahead and tell me if you hear with left or right. What about now? What about now? Okay, and now? Good. Go ahead and tell me when you don't hear this vibration anymore. Just going to put it right here. Go ahead and tell me when you don't hear this sound, the tuning fork. Stopped. Okay. What about now? Now, go ahead and tell me which sound you hear louder, position 1 or position 2. 1 or 2. Okay, what about now? This is 1 and this is 2. 2. Okay. I'm going to whisper some words in your ears. Go ahead and tell me what you hear. Rain. Okay. Magnifying glass. Okay. 1998. Blade. Blade. Okay. And I know you've been waiting for the olfactory nerve test. definitely that's something that we need to make sure is intact. First, I would like to check for patency. So what I'm gonna do is I'll ask you to cover your right nostril, just like that. Perfect. And breathe in, breathe out. Breathe in, breathe out through your nose. Yes. And then on the other side, just gonna cover it for you. And breathe in. And breathe out. Okay. There doesn't seem to be any obstruction. Both nostrils are free of passage. Okay, I'm going to ask you to close your eyes and I will give you a scent that is pretty strong. You should be able to identify it very easily. I'm going to have you identify its characteristics, like a description. Give me a descriptive word. Okay. I'm going to have you give me a descriptive word first and then try to identify what it actually smells like. What's the object? Okay. Go ahead and have your eyes closed for me and take a deep breath in through your nose and out through your mouth. Again, just breathe in and breathe out. What does it smell like? Yeah, this one is plum cashmere, so you're very close. Okay, go ahead and have your eyes closed one more time. Breathe in slowly through your nose and exhale. One more time, breathe in and slowly exhale. Also, that is very close. This is rosemary and sage. Go ahead and take another deep breath in through your nose and out through your mouth. And again, breathe in and breathe out. This one is lavender. Yeah. I have here one more taste. Go ahead and take another slow deep breath in through your nose and out through your mouth. And again, breathe in and breathe out. This one is grapefruit saffron. Going to check your mouth and in the back of your throat. Go ahead and give me a big ah. Ah, good. A little bit of swelling behind the tongue. Tongue does look symmetric and pink. You don't seem to have any redness around the cheek and the gums. Okay, go ahead and give me a big smile. Good, frown. Puff your cheeks. gonna have you keep them puffed for me. Don't let me unpuff them. Good. Go ahead and stick your tongue out and move it up and down for me. Okay, good. Left and right. Good. Can you go ahead and push your cheek with your tongue? And the other side. Okay. All right, I'm gonna try to push your head to the left. Don't let me do that, okay? Good. Let's go ahead and do the same thing on the other side. So resist. Okay, good. I'm gonna try to push your head up. Don't let me do that. Good. And down. Okay. I'm gonna have you squeeze my fingers. Hard, hard, hard. Okay. Go ahead and put your arms like this in front of me. Just gonna slightly push down. Don't let me do that, okay? Okay. I'm just going to give you something to taste. This is going to go on your tongue. Go ahead and open and taste. And what does that taste like? Okay. That one is definitely tricky. So let's go ahead and try a new flavor. I know that these flavors not always are pleasant. So the purpose of them is to revive your nervous system and retrain your brain on how to taste again. If you're having problems tasting, go ahead and good, thank you. What does that taste like? Very bitter, that's good. It is supposed to be bitter, that is what this vial consists of. Okay, go ahead and open. What does that taste like? Okay. I'm going to do a neurological test on your face. We're going to check for any deficiencies in the trigeminal nerve. Mostly the trigeminal nerve innervates the face muscles. So we're gonna go ahead and check, see if there is any asymmetry. Go ahead and close your eyes. Okay. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Okay. So go ahead and tell me if you feel this sharp or dull. Okay. Next, I'm going to take a look inside your ears, okay? Go ahead and turn your head that way. Seems like there's a little bit of redness. The tympanic membrane looks grayish. A little bit of fluid behind it. A lot of wax as well. Could definitely do an ear cleaning. Let's do the other side. Okay. This side looks a little bit better. Does look like there is some inflammation that's coming from your right side. But the tympanic membrane is also pearl gray, so that's a good indication of healthy membrane. And since there's no associated hearing loss, then that's definitely a really good sign. Okay, so let's go ahead and switch. This doesn't work. Oh, wait. There it is. Okay. Just going to take a look inside your eye. We're looking for the optic nerve to see if there is any macular degeneration. I'm going to have you look behind me straight at the wall. I'm just going to come very close to your eye and take a look behind the retina, okay? Go ahead and keep your eyes. Go ahead and keep your eyes as open as you can. A bit of inflammation on the right side. Some scarring visible. Does seem like there is some macular degeneration signs, but I just don't want to jump to any conclusions. I'm going to refer you to a very specialized ophthalmologist who will definitely know how to do more tests and to give a proper diagnosis. Okay. I'm going to prescribe a few medications for you since you do have a little bit of high blood pressure. We're going to adjust your metoprolol. Okay. Since you do have a little bit of high blood pressure, I'm going to adjust your medicine. We're going to raise it from 25 milligrams to 50 milligrams. And you're going to have to take it twice a day. So that's BID, one time in the morning, one time at night. And next time when you come in, I do want you to get another reading of your blood pressure. The one in the evening would be better. Okay. And let's go ahead and just refer you to ophthalmology, also cardiology. And we're going to run a few tests for cardiology just so that they have tests and then they just do their assessment. We're going to do an X-ray, EKG, MRI, CT of the neck and chest. How is your pain level right now? Okay, so it definitely diminished. That's good. Sometimes relaxing definitely helps with pain management. All right. I concluded my exam for today. Let me know if you need anything else.